Hi guys, Dr. Wally here from Prestige Animal Hospital in Fontana. So today we thought we'd talk a little bit about anesthesia and the process of which your fur babies go through when you drop them off here in the morning for a procedure like a surgery or sedation or something more painful that they need to be under anesthetic for. So essentially we have the pet parents fast their pets after 10 p.m. the day before. Water is fine, no food in the morning. They drop off generally before our appointments start so they can fill out surgical paperwork and whatnot. We have them drop off about an hour before we open to see appointments. Then when they drop their pets off, essentially we bring the pets to the back. The technicians will collect the blood and start running the blood for that if it's required for the anesthetic procedure. So that time, by the time the doctor gets in, the doctor comes in, does an examination on the pet, then evaluates the blood work. As long as the blood work looks fine, then we proceed with the anesthetic procedure. The importance of blood work, if something's wrong, we stop right there and we call the clients. So as we proceed, basically what we do is the doctors will come, then fill out this anesthetic sheet that has the medications, the pre-medications, the post-op medications, pain injections, antibiotics, anything we're going to need for the procedure that day. So the technicians are aware and they're communicating on those lines. The next thing we'll do is if blood work looks okay, the pet, we do a full exam, they check out, they're doing great, then we pre-medicate the pet. What that means is we give sedatives so they need less gaseous anesthesia. And they're calm and we can, it's not as painful because we always give a pre-anesthetic pain injection as well with our procedures. So after that and they're sedate, we shave their arm so we can get a venous access and place an IV catheter. So the IV catheter allows us to give medications intravenously or hopefully it doesn't happen, but if they have a reaction to the anesthesia, we have venous access to give them medications to help correct anything that may be going wrong. They also get fluids during the anesthetic procedure, which helps them recover and stay hydrated. After we have placed the IV catheter and the pets are a little sedate, we try to go ahead and shave any area that we may need to be shaved for the surgery. And typically it's done outside in the treatment area. It's just right now everybody's working, so we decided to come in here in surgery where we try to keep the area more sterile. Every pet then, after we shave them and we've had the IV catheter, is induced with an induction agent to help them go to sleep. And then we intubate them with an endotracheal tube, which means we protect their airways. So we always have a flow of constant oxygen that we can provide to the pets during the procedure. Every pet here will get an endotracheal tube. Once they're intubated, we connect them to the anesthetic via the anesthetic machine, and we provide them with oxygen and anesthesia, and we hook them up. So here we are very stringent on monitoring. So anesthesia, we always have one person dedicated for anesthesia for the pet while the doctor is doing the procedure, and we monitor. So we check their oxygenation, their blood pressure, the EKG, all by this little machine right here. And we also provide, like we talked about before, IV fluids to keep them hydrated and keep an eye on their temperature, respiration, and pulse rate. So this object here too, as well, is basically used to keep the pets warm to prevent hypothermia. So all this basically takes time from the time you drop your pet off to the afternoon when we start our procedures. Then after the procedure, depending on the length, we have to wait for the pets to recover and make sure that it's safe for them to go home and they came out of the anesthetic and haven't vomited or done anything that would make us take some additional steps or provide some additional medication. And typically that's around 4:30 in the afternoon. Sometimes it could be later, sometimes earlier. But in general, that's what it entails when you drop your pets off for anesthesia, and we're always with them and keeping an eye on them. And we hope to see you and your pet soon, and hopefully that helps ease your guys' mind of what happens to your fur babies when you drop them off here. Thank you.